Another vital link in providing care here at Children's Hospital is the Neonatal Intensive Care Unit, or the NICU. Every year, more than 800 babies are admitted here. This NICU has the distinction of being the only Level 4 NICU in the entire region, treating children with respiratory distress, gastrointestinal and neurological defects and infections. We met one mom whose little one is being treated here. She shares her story.
They checked and I was 5 centimeters dilated. So baby was coming and they couldn't stop it. Hey buddy, can you open your eyes again? Oh, I see you.
After 3 successful pregnancies, Catherine Rank's 4th child did not come easily into the world.
So then they checked to see if the baby was head down so that I could deliver that way, but he was breech.
Less than 6 months into her pregnancy, the staff at Providence Sacred Heart took action that she says saved her life and the life of her son.
They said emergency C-section, and it was just like, just like 100 people doing 100 things to me all at once, whisking me to the OR.
15 weeks premature, little Joshua was born weighing 1 pound 10 ounces. He was taken immediately to the Neonatal Intensive Care Unit at Children's Hospital, where a primary concern was his underdeveloped lungs.
Like I said, he was intubated, so we had a tube down his throat, and he was hooked to a machine that was breathing for him.
Joshua had surgery to close an opening between his heart and lungs. Now 3 months into the NICU, he needs 24-hour attention, which he receives from the same nurses during his entire stay.
We are so thankful. We have 2 day nurses and 2 night nurses who have decided to be our primary nurses. So whenever they are working, they're taking care of Joshua, and that has been amazing. This is how I say thank you to the staff, and I want Joshua to be able to know who helped him get over all these hurdles.
Since his birth, Catherine and her husband have traded off, one being with Joshua while the other attends to their 3 children at home. It's become their new normal.
It took a while. I was very overwhelmed at first.
But a special team in the hospital's Sunflower program has been there with support for the entire family.
Carolyn has been great. She checks in on me like once or twice a week just to see how I'm doing. Then there's Krista. She's a child life specialist, and she's helped my kids relate to Joshua.
For over 3 months, this has been his world. But Joshua now weighs nearly 6 pounds, and he's getting close to the day his family can take him home.
They are saying before Christmas, so I don't know if that's December 24 or December 1, but sometime before Christmas.
The NICU also treats children with congenital heart problems. You might be interested to know that the first pediatric heart surgery was actually performed right here in 1959, and Sacred Heart Children's Hospital continues to be a pioneer in pediatric cardiology. And joining me now is a cardiologist here at Sacred Heart Children's Hospital, Dr. Carl Garabedian. Dr. Garabedian, thank you for being here.
My pleasure.
Talk about the work that you do here at Children's Hospital.
Well, I'm a pediatric cardiologist, and my primary area of focus is doing heart cath procedures on children and babies who have heart conditions. Again, we take care of all children who have all forms of heart disease. They can be as simple as an extra vessel that's still open that every baby has, to more complex diseases where they're born with only half of a heart. Again, I'm the leader of our program, of our department, and I work closely with our cardiac surgical colleagues to have our team function very, very well.
Mm-hmm. So you're saving some of the tiniest babies as well.
Yes, yes.
Yeah.
We're able to now close structures in babies that are as small as 700 grams without even opening up their chest. We can use little small catheters, just snake it up through their femoral vein and actually close structures within their heart. That's a brand new procedure we started offering just this year here.
Give us some perspective on the size that you just mentioned. 700 grams, did you say?
It's a little over a pound.
Oh my goodness.
Yeah, it's a little over a pound, so that's not very much.
Mm-hmm. And then they're able to grow up and for the most part lead normal lives beyond that?
Absolutely, absolutely. They typically get these heart conditions that they have makes their difficult stay within the NICU that much more complicated. So having underlying heart disease plus their prematurity can make it very challenging for them to grow. And so eliminating some of these structures can help them grow and live more normal lives without long-term problems.
Mm-hmm. How many patients do you typically see in a year?
Well, our program here performs about 150 heart operations on people who have congenital heart defects, and that's defects that you're born with. We do about 150 to 200 heart catheterization procedures also to treat various heart conditions.
Mm-hmm. And innovation is playing a huge role now in the work that you do.
Absolutely. Absolutely. Historically, I'll take an example of a procedure we'll be doing later this week. Babies who are born with a half a heart called hypoplastic left heart syndrome, historically you'd have to perform a very large operation on them in the newborn period, and that has a lot of risks to the patient and their developing brain. We have worked to bring a program here where we can do most of this procedure in the newborn without the heart-lung bypass machine, without stopping the heart, where you can just, with the teamwork of myself and a surgeon, we can palliate or temporize things with stents and little restrictors that we put on the heart. Again, this doesn't fix the heart. It doesn't normalize everything, but it temporizes things so we can do these bigger operations when they're 4 to 6 to 8 months of life. We couldn't do that years back. We didn't have hybrid operating rooms to do heart caths and operations all in the same room. And so this technology has really allowed us to advance and to treat these small babies with these complicated problems.
Mm-hmm. Is it true as well that you're using some 3D technology, printing technology?
Yeah, absolutely. And 3D technology is fantastic. It really helps us take a complicated problem where we have difficulty wrapping our minds a little bit around how to repair these hearts. And sometimes just having that heart in your hand to look at it, to decide what is that relationship between the aorta, the coronary arteries, and all the different vessels to help plan the operation. A good planned operation is the best kind of operation. You don't want to be planning or making changes on the fly. This 3D technology really just takes the 3D applications we have from MRI and CT scans, and you just take that data set and send it to a printer, and you can print heart models and help you decide what to do.
That's amazing. Mm-hmm. Are many of these techniques being developed right here at Sacred Heart Children's Hospital?
We aren't developing these procedures here, really. Pediatric cardiology is a very technical field, and there are so many different types of patients with various types of lesions. So it's hard for us to develop certain things because we don't have a million children with this type of single ventricle or that single ventricle. When I use the term single ventricle, there's about 100 different kinds of those things. But we're very aware of the advancements that are out there, and we are very quick at adopting these technologies. The Piccolo device, which is the device now available to close PDAs in children 700 grams or greater, was just available this year, and I jumped right into that to start bringing that technology here locally so patients don't have to travel anywhere.
Oh, that's awesome. Mm-hmm. And we serve such a wide region, too, that making sure that we reach all of those kids or having them brought here is critical.
Absolutely. Absolutely. Yeah. We serve outreach really for our entire area. Here in Spokane, there's no way that we could have the type of children's hospital we have if we were just taking care of the people here in Spokane. We're a regional center. We care for patients from central Washington, northern Idaho, and into Montana with all forms of heart disease and other types of, non-cardiac problems too, but I focus obviously on the cardiac issues themselves there. We know that once we bring these patients here to Spokane, we do their heart surgeries, their repairs, we know that they've got to go back to their communities. And it's important for us to go back to those communities ourselves and continue to care for them there. We have outreach clinics throughout Central Washington, Tri-Cities, Walla Walla, Moses Lake, Northern Idaho, Lewiston, all over, and other clinics within into Montana also. That helps us really continue to care for these patients on the outside.
And using some telecommunication with doctors in those smaller communities as well?
Yes, we do a little bit of telemedicine. What we're really excited to do is to start a new program we call ePatch, okay? And Patch is our program for adults and teens with congenital heart disease, so the Providence Adult and Teen Congenital Heart Disease Program. The reality is there are now more adults than children who have kid heart problems, if that makes sense to you, okay?
It does, yeah.
That's a great problem. That means our children are not surviving and becoming adults. Well, those adults have a whole different type of heart problems that other cardiologists don't typically care for, and so this is a huge aspect of our program that is now continuing to develop. We realize that these people are out in the community and have difficulty coming in as they have families and other things to come to Spokane, and we're using ePatch, which again is telemedicine, where we can come and meet them in their local doctor's offices. That's something we expect to launch in 2020.
What else is next? Anything else exciting on the horizon you can tell us about?
Well, what's next is really trying to focus on not just fixing these kids, but actually helping them live good quality lives. Historically, when my father was a cardiologist, we were so excited these kids survived their operations and they were growing up, and oftentimes they lived sheltered lives, or their parents didn't let them play sports and this or that. And we realized that we had a real negative outcome from those kids having those sort of limited lives, where they became more problematic of what they can or can't do in their head rather than what their heart can do. And so now our big focus is to have these kids have normal lives. Sure, you may have some limitations, but push yourself as hard as you can. Those kids are going to live longer, have less problems, get transplanted less, have less heart failure if we can get them just to get up and move and shake to enjoy our great inland Northwest that we have here.
Thank you so much for being a part of our program.
Yeah, my pleasure. Thanks.